everyone. My name's Helen Platts, and I've worked closely with Small Steps, Big Changes, or SSBC, on a number of occasions now. And I'm really delighted to be here today to host this first of a series of shared learning events designed and run by SSBC. Now, for those less familiar with our partnerships, SSBC is a national lottery community funded project which aims to improve outcomes for children from pregnancy to 4 years of age around social and emotional development, communication and language and nutrition here in Nottingham. So it's likely that as you joined us, that you share our ambition, passion and enthusiasm for giving all children the best start in life. And we're really pleased to have you here with us today. It would be great if you're able to put your name and your organisation or where you're from in the chat bar, just so we get a sense of who's present in this cyber room that we're going to be occupying for the next hour. I mean, we are aware that some of you are on your phone and won't be able to do that, but we're really delighted also that you're here today. And I hope that you find today's session timely, relevant and thought-provoking. So what are we here to do today? So we're going to share the findings of Nottingham Trent University's recent research around the effects of COVID-19 on families with children under 5 in Nottingham. We're going to consider what that means for how services need to adapt and flex when working during COVID. And in light of all of that, we're going to think about how we can learn from what's happening to support families even better in our diverse communities in Nottingham and actually hopefully elsewhere too. So with me today then, we've got our co-host, Amy MacDonald from SSBC, Professor Carrie Pechter, Director of the Nottingham Centre for Children, Young People and Families in the School of Social Sciences, Nottingham Trent University. I think you get the award for the longest title, Carrie, today. We've got Tara Newbolt, a local parent to 2 children, and Tara's also an SSB parent champion. And then we've got Donna Sherratt, who's the Small Steps, Big Changes programme manager. So hello, everybody. So just a brief word about how this session will run, technology permitting. Amy, can you just fill us in on how that's going to work?
Absolutely, yeah. We'd really like to for people to get involved in the webinar this afternoon, and there's a couple of ways you can do that. On the bottom of your screen, you should see a Q&A icon, and that will allow you to ask questions directly from the speakers. They will be anonymous and only be seen by the panel. I've noticed some of you have already started doing it in the chat box, but if you've got any general comments or reflections throughout the session, if you could pop them in the chat box, and just to be aware, they will be seen by everyone. There's also an opportunity if you want to tag us on Twitter. Cara is now going to post our Twitter handle, so please feel free to do that. And the last thing to say really is if there's any technical issues, Sarah and Katie from Beacon House are on the call. And if you just pop a note in the comment box, they'll be able to support you with that.
Brilliant, that's great, Amy, thank you very much. So please, everybody, do keep your comments and questions. It's great to see stuff is coming in already. We really do want to have a dialogue with you today, as much as technology allows that. So the way we're going to proceed today is, first of all, we're going to hear from Tara, who's going to share her family's experience of COVID-19 and lockdowns. Then we're going to hear from Carrie, who's going to share the findings of her research. And at that point, we'll pause and we'll answer hopefully some questions that you're putting in the Q&A box. Amy will be keeping an eye on that, and will share with us some of the questions that are coming through. Then we're going to hear from Donna, who will outline how SSBC has responded to the challenges of COVID. And hopefully we'll take some questions or comments you have for her after she's spoken. And then importantly, we're going to be asking some questions of you, our listeners, in light of the findings of the research. And we will really welcome your thoughts and experiences and reflections, which we'll share at the end. If we don't get time to share all of them, we're going to be producing that afterwards on SSBC's website. Am I right, Amy? Yeah. So, Tara, I'm going to come to you first. Where are you? You're down on my screen. Hello. Hello again.
Hello.
So tell us a little bit about your family situation and how it's been for your family over these 3 lockdowns. Have they been different experiences for you?
Yeah, so I've got 2 little boys. I've got Noah, who's 7, and Logan, who's 3. My partner has been working full-time throughout the whole of lockdown. Some of that, the first lockdown, that was at home, so that presented its own challenges. And this one, he's back in the office and social distancing and things like that. I think for me, lockdown the first one, it was a bit of a novelty. I know that sounds really bizarre, but I think it was a novelty for a lot of us, you know, all this time that we've got at home with our family. And then it was in the summer, so it was perfect. You'd got all these plans that you thought you could do. I think everybody's gardens are now immaculate and perfect. I know mine definitely is. But for me, there's good and bad points. I think, like everybody, things that I noticed were my eldest became really anxious during lockdown. He would randomly just get things like bellyache whenever he wanted it. He's very affectionate anyway, but he would really, really express his love all of the time, which is lovely to hear, don't get me wrong. But you know, when as a mum you just know something's not quite right, and why is he doing the things? And he would be eating his dinner halfway through and he'd say, "Mum, I love you," and I'd go, "I love you too." He really needed that constant kind of reassurance, and that from both of us, to be fair, from me and his dad. And I think that was down to the fact he didn't have the social kind of aspect that he's used to, definitely from just everybody, really, from family, from friends, from not going to play groups, from being away from family that he would regularly stay with. And also, I think at school at first, I don't think it was really spoke about, was it really? I mean, they knew it was coming, and then obviously in lockdown, and I think it really geared up on the news. And then obviously when they went back to school, about cleaning their hands, and you know, it's a virus. And then I think the kids have slowly sunk in. At first I didn't think they paid attention, but I know as time got on, he really did, and he would ask more questions. And I think that's where the anxiety sort of really started to peak for him, because I think he associated the illness with the coronavirus with our family getting ill.
So he was fearful of that.
Yeah, very fearful for that. And it was really hard as a mum, being mum, teacher, cook, cleaner. You know, you wear all those hats anyway as a parent. But just adding that one aspect in did become difficult, because you're trying to be a mum and be reassuring, but also trying to get them to do some kind of schoolwork that you're, for want of a better word, I was winging it every day. You know, as a parent, I think a lot of my friends, they did the same sort of thing. We'd have group chats on how we dealt with it, on group chats on what do you teach your child. I've never been on the internet or let my kids go on the internet half as much as I had during that first lockdown. We went on Bite Size. We used SSBC's websites. We used links that they put on. We'd had family mentor links. We literally did everything and anything, from making jetpacks to you know, watching Henry VIII videos online and learning songs. Anything that I thought was relevant for them to learn, we really did try and cram it all in. And it was good in a sense, because the time I got to spend with them is amazing.
And what about over the is there a different feeling to this lockdown? To the first one.
This one's horrendous.
Right. Can you say a bit more about that?
Oh.
How long have we got?
Since you ask. I think, to be fair, this one, I really genuinely think it's come at a really inappropriate time. And I know that sounds really bad, but the weather and the fact that it's just come after Christmas, at a time when everybody was feeling really low anyway, because they couldn't see family and friends, and they didn't have that contact with people that you would normally do. I know we definitely missed out on, I think we lost a bit of the magic of Christmas, I think, for me. And then gear it in with a lockdown comes in after it. And I just think it's really just kept everybody mentally low and physically low. And I think it's really hard to try and pull that back and sort of see the light at the end of the tunnel. It's been hard this time round, because now I'm back at work. So I've my little boys now, they're both at school now.
Right.
I have a lot of guilt of them going to school when I'm at work. It is just one of those situations. And I know, you know, people are feeling guilty because they're at home and they're not at work. I think it's just all around guilt, really. I know that my partner, he said the same thing, that for him it was, you know, spending time with the boys was what he's loved. But the hard thing for him has been trying to put a schedule together that works for us as a family, if you are still trying to work and be teacher as well.
So is the guilt at this stage, is it about feeling that you're not spreading yourself evenly across stuff, or what do you think it's about this time?
I don't think there's enough hours in a day to do what I think needs to be done. And I think my worry is that I don't want my children to fall behind. So I think mentally you focus on what they need to do and what they've been tasked with from schools. I know schools have massively, you know, got a schedule together, which has been amazing. Compared to the first time, it was a bit, I think there's been loads learnt this time round, and schools have done absolutely amazing. I know ours have done brilliant, and I can't fault them for what they've done. but at the same time, it's that as from this side of the fence, it's a kind of, how do you juggle all that into normal, working life, home life, school life? It is a lot to kind of expect those children and parents to be fit.
And you so obviously spending time with the kids has its upside. Have there been, we hear about a lot of the hidden harms. Have there been any sort of surprising benefits for your little one, or for is it Noah, the oldest one?
Yeah, there's obviously there's all those I say negative, but there's all those downsides that we've had. But we've had absolute tons of amazing stuff. I have never been and had to use my imagination since I was probably about 7 myself, as I have this year, and it's been absolutely brilliant. It literally has brought the child out in me, being able to be creative. We've done chalk drawings on the street that we've had people follow. We've made jet packs, like I said. My little boy's speech. It wasn't, not that it wasn't the best. It was fine. I suppose people would say it was adequate. But I noticed it. I suppose you compare, don't you, when you've got to?
Yeah.
And his speech didn't seem to be quite where I would thought it would be. But then during lockdown, we've had, because he's only had us, we've chatted to him so much, we've engaged in that conversation, we've spoke about everything and anything, and it has just absolutely flourished, and it's come on leaps and bounds.
That's interesting.
And his confidence. He genuinely doesn't think he needs to wear clothes anymore. That's the downside to it.
And I'm still wearing my yoga pants, so I've gone out of trousers. I
think the social interaction side of seeing other children wear clothes, that's where we've lacked. He just thinks he can walk around in a pair of pants in the garden in all weathers now. That's apparently quite normal. We've gone full Tarzan. But the time we've had together, I'm never going to get that back.
No, it's very different.
I'm never going to get this lockdown time back. And we've had so much of it as a family. We've just been able to do things that have been just spending time together, watch a film, not rush to work, not rush home from work, not have a schedule of, I've got to take him to this activity, or I've got to take him to that activity, or get out the door quick because we've got to go up and do the school run, or all those things that kind of you don't really think, but at the same time, when you've not got to do it, you've all of a sudden there's time.
Yes,
there's an abundance of it.
And just so looking forward then, Tara, very briefly, what do you think service providers need to learn from this experience? What do they need to bear in mind as we emerge from this period? What needs to be different? Do you have any thoughts about that?
I think they took what happened in the first lockdown, definitely schools have. So whoever did that, well done. You dished out some schoolwork and things and made life a lot easier on what I'm supposed to do every day. So that was amazing. I think for me, I think it's mental and physical now. I think the mental thing of children, for want of a better word, being isolated and only having parents, and newborn babies only having that stimulation of mum and dad, whereas normally you would go to a play group, SSBC run loads of play groups, and you could pop off to one of those, or you'd have your family mentor and they'd help you through that, which I know they have been doing virtually and things like that, but there's still not that contact with that people. So I think a lot of young ones are going to suffer with more separation anxiety. I know that obviously social, with them not being in play groups, they've not had that bonding time that they would normally have, and that learning and that development that they would normally have. And the physical side for me would be just when my son went back to school after the first lockdown, I noticed he was so tired, but he was tired, but then he was so hyper. I mean, I didn't know which way to go. I was like,
interesting.
Do I hug you? Do I tell you off? Do I give you time out? What do we do? It was genuinely really hard to work out. And because we'd never had that experience of all of it in such a small space, it was really hard to work out what road to take. And we literally just asked everybody. I asked my village friends what we did. I asked, I would WhatsApp group people. I would speak to SSBC. It was just that whole, what do you do in this situation?
So we're going to be facing some interesting things as kids go back. I
don't think it's necessarily isolation. I think it's physical as well.
Okay, thank you, Tara, so much. We're going to have time for questions and discussion later, but I'm going to turn to you now, Carrie, and ask you, can you explain for us the research that you carried out and what its main findings are? I'm interested in, how does it reflect or differ what we've heard very vibrantly from Tara there? Thank you.
Hello. So, here's my screen. So I'm going to talk about the research that we did, and we did it during the first lockdown. Well, we did it after the first lockdown. So the research took place in July and August of 2020, and the interviews were carried out by Rachel Harding, not by me. Just so you know. So we did 29 interviews with parents from 27 families. So 27 women and 2 men, and the men were the partners of 2 of the women in the study, and they were all living in Nottingham, sort of the wider Nottingham, and all but 2 were in the city. And we were trying to prioritise SSBC wards, but we basically got who was prepared to talk to us. And all these families had at least 1 child under 5. Some of them had several, some of them had just 1. What we were interested in finding out, what SSBC had asked us to find out, was what lockdown was like for them and how they'd coped and their hopes for the future. And they also, SSBC really wanted to know the child's experiences. And we didn't feel it was really appropriate to just ask the children. Some of them were very small, some of them were newborns. So we asked parents how they thought their child felt about lockdown. And some of the parents found that an easy question to answer, and others didn't. And so we've got quite a varied response to that. But we do feel we've got some picture of the child's experience of lockdown. I'm going to talk about what we found out in 2 sections. I'm going to start by talking about the good stuff, and then I'm going to talk a bit about some of the problems that people experience. So can we have the good stuff slide, please? So as Tara said, a really important thing for some families was bonding as a family and having more time together. But we definitely found that was more appreciated by fathers than mothers, and partly because the fathers were suddenly at home, when they had often been going to work very early in the morning, coming back, sometimes when the child had gone to bed, they didn't know their children very well, and it allowed them to spend more time with their families and more time with their children. And parents often commented on how that the women often commented on how their male partners had got to know the baby better, particularly. Some parents found that their children benefited from having a routine at home in lockdown, that having that routine, which was a daily routine in the home, was actually very good for their children, and they got very settled, and they were more settled from when they were out and about doing things. And so there were benefits to that for some families. In families where there were older siblings, parents talked a lot about how much the younger ones had learnt from the older ones, and how nice it was to have the older ones looking after the younger ones a bit and playing with them, and the older siblings being at home rather than at school, and how that also worked out. Of course, it also meant you often had a small child while you were trying to do home education with an older child, and that couldn't be so good. But there were definitely, again, things about having the whole family together that families with more than 1 child appreciated. Some parents talked with enormous appreciation about how some health professionals went out of their way to help families. So we had a story about a breastfeeding mum who was a new mum and new breastfeeder, who got in a complete panic about whether her child was actually taking in any milk. And the health visitor basically, a lot of them had been redeployed, so they weren't around. But her health visitor came out against all the rules and full PPE and weighed the baby in the garden in order to reassure this parent. And somebody else talked about a hospital consultant and his staff being very, very attentive to the family, and again, coming out of the clinic and supporting them. So some health professionals were just marvellous, but that, as we'll see in a minute, wasn't always the case, and it wasn't always easy. Parents talked about how wonderful telephone appointments with the GP were, because if you wanted to take a child to the doctor, or even yourself to the doctor, normally you would have to get all the children into their coats, and you'd have to get them all there, and you'd have to amuse them in the waiting room, and all of that and all of that. And actually you could just have a phone appointment, and parents really were hoping that phone appointments would remain an option for their families, because it just made life a lot easier. And I think that's something we can take forward. We should look at, it would be good if general practitioners could take that forward. And the other thing parents talked about was how they got to know their neighbours better. One person talked about a neighbour who'd been really difficult about the children playing in the garden and noise, who became very supportive and was dropping things around and being much more chatty and so on. So I think that sense of neighbourhood for some families was really good, and they got better relationships with their neighbours. So those are some of the good things. Now let's look at some of the not so good things. And there were a lot more not so good things, to be honest. Parents were really worried about themselves or the families catching COVID-19. It made them very, very stressed. Some families didn't leave the garden for the whole of the first lockdown period. So they were just in the house and the garden together. And parents were also really worried about finances. Of course, some people were furloughed, some people had lost their sources of income entirely, and they weren't being necessarily supported by the government. That was very difficult. There were some really serious difficulties about baby milk, and to a less extent nappies, but baby milk was really, really worrying as a problem, because there was panic buying. And if you were used to buying your baby milk week on week, you'd get to the supermarket and there would be none. And we were told by a breastfeeding parent that the breastfeeding mothers had got together and discussed breaking lockdown to express milk and give it to the bottle feeding parents, because there was such a worry about access to baby milk. So I think, I don't know what's happened as a result of in the subsequent lockdowns. There has been less panic buying, but it was a big problem in the first lockdown. Apart from the healthcare staff who did go out of the way, there was a general lack of access to healthcare staff, and people really missed the health visitor teams when they were redeployed. That was a big, big problem for people. There was also a lack of access to disability assessment, to support and physiotherapy. One parent talked about not being able to get fitting for her disabled child's special shoes and having to sort of guess it herself and order them online. Children missed out on specialist physiotherapy and other forms of therapy that will not, there are windows for these things, that speech therapy, for example, that have now been missed, and that's very problematic. We found that some parents sometimes had gone to an activity every day, and suddenly to have them all cancelled made them very, very isolated. And some of these parents were single parents with one child. So both the parent and the child were sort of stuck on their own until the support bubble policy came in. And what this meant what it meant for the children was that they only spoke to one adult through the entire lockdown period. And that is not good for children. I mean, it's just really not good for children to be isolated with one adult. The parents were slightly less isolated in as much as they had phones and they could use the internet, but they also felt very isolated and sometimes very frightened. Parents, particularly single parents, had no time to themselves at all. And they were often, trying to find activities that would keep their child occupied, even for 10 minutes, so that they could have a chat on the phone while their child was playing in front of them. That was, very, very stressful, particularly for single parents. And for parents who had extended family, either locally or abroad, both the parents and children were missing contact. One person talked to us about a child who was used to seeing their grandparents every day, and the grandparents lived next door, and they couldn't understand why they could talk to the grandparents through the hedge, but they couldn't actually visit. And there were other families who had extended family visits or visits to extended families, often abroad, that were cancelled. And it also meant that the children who were often learning heritage languages from their grandparents and speaking with them with their grandparents were losing access to that.
Okay.
Working parents, really difficult to work at home and care for children. I know, we all know that. Some employers were not sympathetic and just expected parents to put in the same time as they normally would, and that was very difficult. One thing that started to become very apparent at the end of the lockdown was that children had lost confidence with adults outside the immediate family, so that even people that they were really used to, like uncles and aunts, they, you know, when things opened up again and they would visit, the child would hide from them, and that was very distressing. And children were very, they very much missed outside play, and access to parks and play areas. And parents told us heartrending stories about their 2-year-olds getting their coats and standing by the front door, really wanting to go out, or going on walks with the children, and the children looking at the play areas which were shut and being sad, or later on children playing in the play areas and them not being allowed in because the parents were worried and being sad. So it was very clear that children missed, you know, one parent said he's looking at the play area and I can see he wants to play with those children.
Aware of time, Carrie, and thank you. And I'm hoping we're going to pick up some of those points later, but thank you very, very much for that. Really interesting. And I think it would be a good time now to hear from you guys out there. Amy, questions, comments coming in from those of you listening that we can put to Carrie, and I'm going to invite Tara back in too now at this stage. What have we got, Amy?
Yeah, we've had some really positive feedback around Tara sharing her story, and sort of lots of thanks for doing that. And those sort of with older children, still sort of the experience resonating with them as well. And also something around the value of spending time and play, which you sort of picked out really nicely. Something just from the health visiting service that I'd wanted to mention is they did actually maintain locally the antenatal and the birth visit. And where needed, they were able to provide some sort of face-to-face support. I guess coming to the questions, there was a comment about the dads that were interviewed and whether or not their reflections were perhaps what you'd expected.
Yes, yeah. I mean, you know, it was hard for dads if they were trying to work at home. It was harder for the mums who were going, you know, Dad is in that room, don't disturb him, he's working. So actually there was a problem for the problem was for the mums who were having to protect the father with the work time. The dads loved it. I mean, if you've got an hour's commute each way that's gone, that you can now spend with your 2-year-old, that's a bonus.
What else, Amy? Was there questions about the impact of hygiene? You know,
I think there was something about whether or not there's going to be long-term impacts on children around kind of the additional hygiene measures that have been put in place, and whether that may have an impact on children.
Carrie, what were your thoughts about that?
We've got no evidence. Nobody mentioned it.
Okay.
Nobody mentioned it, but I think there'll be long-term impacts of an awful lot of other stuff.
Tara, do you want to say anything about that? Because you did mention people, you know, kids being a bit more anxious. Do you think the hygiene stuff is going to play out? I
know the schools have definitely been, and nurseries and things like that have definitely been really sort of gearing up the whole wash your hands when they go outside and things like that. And kids have really sort of brought that home. It has, you know, it's great. And it is brilliant hygiene, yay. But I think it's just the flip side to that is, do you know when you're a kid and somebody says to you, germs won't hurt you, go outside, it builds your immunity, on you go out there, go and make a mud pie, yay. And then now this has happened, I kind of think it's took that real natural kind of ness away from it, if that's one of a better word. Like I was hoping that my kids go outside and just play. And they would find insects and bugs, and it grossed me out completely. But it was one of those like, well done, son, you've found a worm. But now it seems that that's been taken away, and it's very clinical, it's very clean. And I just wonder if that's going to have an impact when we come to playgroups, especially for the younger ones. Going forward, are they going to suffer with, yes, you need to have hygiene measures, but we've always been to playgroups and they've done very much natural kind of things. They bring the outdoors indoors, you go outside, you play, you explore. So I think it's just trying to find that nice balance of, yes, you can still do that. Don't take that away from kids, because it's something that mine have absolutely loved, but just kind of bring it, you know, be realistic. I think that's still got to happen.
Yeah, thank you, Tara. Yeah, and I think Alison, I've lost the comment, but there was a comment in the panel there. My bar is coming and going. Amy, Alison, I think Vaughan was saying that the King's Fund are going to be doing some research. Do you still have that comment? Can you share that with people?
Let me go back to it. Yeah, so children's mental health planning, the King's Fund will soon be sharing on their website the lessons learned about mental health during natural disasters and big events. Very important for services to know how to plan for the future with regards to children's mental health and to reduce the long-term impact.
Yes, yeah, true. And Carrie, I saw in the report that one of the recommendations that you made is for people to make strong representations to government, local authority and policymakers around thinking about children and the impact on children. So how do you suggest that those of us who are listening, parents and professionals, might do that?
Well, there are various ways you could do it. That every so often they actually ask for responses to parliamentary inquiries, and there have been a number about COVID-19 over the last year. So that's what we've done. We've actually put our evidence in responses to parliamentary inquiries. I also sent the Minister for Children and Families a link to the report, but I have no idea whether she's read it. So you know. I think whenever you get a chance, whenever you get asked stuff, answer and get your views out there.
Yeah, absolutely. Another comment coming in that it's not just hygiene, is it? It's this impact of being careful about hugging and kissing, and that physical contact that I've noticed the loss of that as an adult, and how that must feel like with children. Tara, have your kids picked up on that?
Do you know what's really funny is my little boy, I'm a big hugger with my kids. It's how we show affection. We hug, we kiss. That is just our way of doing it. But what I've noticed is my little boy now, he told me he couldn't kiss me because of germs. Now, I'll be honest, as a parent, it stabbed me through the heart. It broke me. It genuinely, absolutely broke me when I heard him say that, because I went, but I'm your mummy. And he went, no, mummy, you have germs. And I went, I gave you those germs. So we kind of had to have a whole discussion on, I'm your mum, that is allowed. And he's become very standoffish if it's kind of even suggested. We even so much as hugs anybody, it seems like it's a really taboo thing to do. It's something that I expected, but when it happens, it's a completely different thing. I knew it was going to come, and I did expect it to come with everything that had been said and what schools have said, but to hear it was heartbreaking.
Yeah, and we can imagine some things that will come when we return back to something like normal,
I think it's
or the new normal.
Yeah, definitely.
Yeah, brilliant. Well, thank you. Carrie, do you want to say something there?
Yeah, I just want to say parents also told us that children had got really frightened of strangers, so they'd be on a walk and another family would come and the children would run away. And I've experienced that as an adult walking the Arboretum, that small children run away in a way that they never did before.
Yeah. We're going to have some really interesting challenges, aren't we, as in society to find the way to respond to that, and for service providers, really difficult and time to think and plan now, as a couple of people have been saying. Well, thank you very much, Carrie. We're going to turn to Donna now. And Donna, I'm going to ask you to talk about how SSBC itself has responded to the challenges of COVID-19 and the recommendations from the NTU report. And a reminder, guys, please, if you've got any questions, either for Donna or anybody else out of that discussion, please keep them coming, and we'll have another look at those after Donna has spoken. So over to you, Donna. Thanks.
Thanks very much. And yeah, that's a great intro from Carrie and Tara. And this section is just, as you've said, talking about how we've responded to those recommendations. So if we go on to the next slide, these are the 8 recommendations. So they spanned around putting parents in contact with each other around the isolation, having children's voice in the decision making, making strong representation to the government around considering children in policy in such pandemics moving forward. Also avoiding pausing services where possible, amplifying opportunities for outdoor activities, and ensuring that we're effectively using telephones and video conferencing instead of the face-to-face delivery within that. And also that early intervention alongside understanding families' needs before they become problems, and then also looking at how we can have different languages represented in those different stories and online sessions that we're doing as well. Quite a lot of recommendations, huge amount of things that we have done in response to those. So if we move on to the next slide, what we've done is I've themed them into 4 areas. And for us, what the report did, it gave us affirmation for adaptations and approaches that we'd already taken early on, in terms of all of the conversations. You know, Tara's spoken about the experiences that she's had, because we're connected with family mentors, parent champions, and with the community. Very early on, we were able to identify what some of those challenges were. So the report gave us the affirmation. It helped us to focus on areas that we were already curious about, and also helped us to sharpen our focus moving forward. So as I say, we split it into these 4 themes, and that's how I'm going to respond to the as to what we did, and also some of the recommendations as we move forward. So if we move on to the next slide. So conversations already happened about this, really, with regards to influencing policy. From the programme's perspective, it's something that we want to influence locally, nationally as well, and we do this in lots of different ways. As you can see, the slide on the looks at all of the different evidence that we've submitted in different ways. And if I draw your attention to the impact of the life after COVID, that was one where we had 3 different submissions. So we had a written submission, which was based on some qualitative questions that we carried out with families. We also had a creative approach to capturing the views of workforce, the wider workforce, and family mentors as well. And the visual minutes that you can see there captured that from the workforce perspective. And then something that we're really proud of, and I'm sure we'll see a smile on Tara's face, that Tara and Amanda as parent champions were invited to be part of a focus group with Lord Harris and Lord Elder and Baroness Morgan as well. So that was in the virtual world, but a focus group sharing directly with those people to add into the inquiry their thoughts, feelings, experiences, and hopes and for the future as well. And we've seen some slight changes, and you know, we've described what things were like in that first lockdown. And some of the things that we've seen is that there was a really clear directive from senior leaders from the NHS, Public Health England and LGA, and this was around communications to the early years workforce, and that was around protecting the children's workforce from being redeployed in future situations where lockdown was happening. So we're seeing that. And I think one of the other things that we were aware of that changed, so just before the 3rd lockdown, when the tier system was implemented, you know, it came to light that parent and child groups were now exempt from closure during all of those tiers. So we are starting to see the influence of some of these things moving forward. So the programme has a great appetite around research, and one of the most recent reports that's been released recently is the first 1001 Days movement, and there's a report about working for babies, and it mirrors many of the themes that, you know, we saw here in Nottingham and that was represented in the NTU report as well. And one of the key things is around relationships, and it's one of those things that we don't necessarily represent in a you know, as a issue itself or an opportunity itself, but once I run through the other activities, you'll see that that's a common theme as we run through. So if we go on to the next slide around isolation, the programme is in a great position to have strong relationships with families and partner agencies as well, which was enabled us to not only hear but also crucially respond to what we were hearing early on. And so all of the things that Tara spoke about, we were able to hear those as we, you know, built up the weeks went on, particularly in that first lockdown. And parent champions themselves between April and June held 403 conversations, and these were bringing up the challenges around isolation, development regression that families were concerned about, managing behaviour when you might have had all these other things to pull on outside of the home. You were having to, you know, manage it within, you know, whatever you had within your home as well. So all of these things helped us to build a picture of how we could adapt some of our services. And one of those was repurposing our ideas fund. So we have an ideas fund which is about community commissioned services, and we expanded the financial envelope. So we had £50,000 and it was across, we could go outside of the wards to encourage a response that was going to support families during the COVID-19 pandemic. We had an overwhelming amount of applications for some really great, interesting activities. So we were able to expand the fund to up to £100,000, and we supported 21 applications. And so some of those projects were, for instance, it was a travelling puppet show that went to doorstep, so socially distanced, but families could access that from their own doorstep. We enhanced some outdoor spaces and invested in support for families with things like an emotions toolkit. Another way that we used the assets that we already had, it was identified in the report that loneliness was felt, you know, for lots of different people in lots of different ways, but the impact of that was sometimes even greater if you have English as a second language, partly because some of your networks that might have helped you to navigate life in terms of reading letters and all sorts of things, you weren't necessarily able to do that. So we worked alongside Nottingham City Council, who already had a loneliness page on their Ask Lion website, and that after discussion came up with the idea of having one specifically around English as a second language, which gives a direct link into other people having some of those challenges or making connections, but also some of the support networks to support with that as well. If you're from Nottingham, you'll know about SSBC have commissioned a family mentor service who deliver small steps at home, and that's played a significant part in the amount of support that families got. So this, and there is a really rapid response to changing that service to maintain some of those relationships. So we've got a paid peer workforce who support that, and they've been phenomenal in the ways that they've adapted, and you'll hear that as I talk through the other elements within this. But one of the things was that they made wellbeing calls. So 3,638 wellbeing calls were made by the Family Mentor Service to families between April and December. So if we go on to the next slide, which talks about how we adapted the services, and you can see some pictures there where we've got the family mentors with resource packs. And interestingly, and something that we're looking at with more focus over the next few months is that the Small Steps at Home service continued to recruit new families during this time. So we had 320 new children sign up to the Small Steps at Home service during April to December. And as you can see, there's a picture with resource packs that they delivered out to families. So that was a great way to enhance the home learning environment, providing the resources and also the activity ideas as well. Another element that we commissioned Sojo, who's a local artist and is focused on the imaginations of children. So they've produced 9 videos, interactive sessions that families can watch at their leisure because they're on YouTube, and they covered things like, as Tara said, you know, the world had changed significantly, and young children were walking around thinking, why has that person got that thing on their face? What does that mean? I feel scared. So addressed all of those types of things. One of the other areas that we focused on was the acknowledgement of the movement around Black Lives Matters, obviously following the death of George Floyd, and that COVID-19 was having an adverse effect on Black and ethnic minority groups, and the great concerns and worry that were happening within that. So as a programme, we recognised that we needed to potentially review our approaches, reset where we were, and be honest about the different elements that we needed to look at within the programme. And that was a great place for us to have the conversations about how we supported access and making sure that we were reaching the diverse community that we work within. We also saw a great response from National Literacy Trust with Read on Nottingham in terms of uploading videos in lots of different languages, and also supporting their literacy volunteers to become digital literacy volunteers. And we had some real success with an Urdu and bilingual and Hindi read stories and nursery rhymes, lots of different views and lots of interest in that. So that's something that we think we'll continue to develop moving forward. So the next slide talks about what next. So we know there's more to do. We're really excited, passionate, and looking forward to the next 5 years. Obviously, COVID was never written into the plan of SSBC, and we, trying to flex and develop alongside that. So some of the commitments that we've got is to hear directly from children more. So we did try this in September. We didn't have a massive uptake, but with our improvement science focus, we're looking at how can we do more of that. Just because it wasn't a great success the first time, we will continue, because we can see the great importance in having supporting children's voices to be heard. We've already built into our local evaluation for year 2 with Nottingham Trent University to have a focus on the perceptions around face-to-face versus online delivery of services and activities. So we're really looking forward to that research, and we always learn a lot along the journey of carrying out the research, let alone with the findings at that point. And I think it goes without saying that mental health was always on the agenda for the programme, and layering Covid-19 on top of that, it's a real focus for us moving forward. And we're just on the cusp of awarding a contract for a parent infant mental health team. So this will go some of the way towards that, but we recognise there is much to do. And I think the final point is just that commitment and ambition to be a child-friendly city. So we've got funding and working alongside Nottingham City Council to be a child-friendly city where young people have great opportunities to play, educate, grow, become citizens, and continue to be the future of Nottingham. And how do we help them to be the best that they can be to do that? So that's my whistle-stop tour.
Thank you.
Sure I've probably overrun by a minute or so, but happy for questions.
Yes, thank you very much. The questions coming thick and fast now. Can I just ask a very simple one for you, Donna, first? Is there going to be an Ideas Fund this year?
Yep. So
okay.
We've got, yes.
Okay, brilliant. That's a really easy one. Let's hear from Amy then. I know we won't be able to answer all these questions, but Amy, we are going to keep those and answer the questions as we can, aren't we? Is it on the website?
Yes, yeah,
brilliant.
That's right.
So can you choose a few that you think, if there are themes?
Yeah, just a couple of comments really, just around the sort of creativity with the Ideas Fund and how good that was, and also really good to hear about the successes of recruiting to the Small Steps at Home programme. But there was just a question about how challenging that was in lockdown, and whether or not you'd seen any differences in terms of recruiting.
Really interesting. We didn't necessarily see a massive dip at first, but we're just at the cusp now where we're starting to see that there are dips in certain areas. And we've got Jack within our data evaluation team is actually doing some work at the moment to look at the numbers alongside the effects of whether something went up or down when we had a national lockdown or when different tiers were implemented. So it's something that we're trying to understand in more detail. I think particularly with Small Steps at Home, because it's a relationship-based service, and as we've heard, those those acts of kindness, neighbours who'd never spoken to each other before, having those conversations, I think that what we saw was those relationships almost superseded the processes that we might have had in terms of engaging those families.
Interesting. Yeah. Anything else, Amy, that you'd like to put? I know there are a couple of questions which are more towards Carrie, I think, really, that have come through, which is about, did you hear from somebody who's doing some research around children with special educational needs, and did you hear anything that particularly applied to them in the research?
We had one or two things. I've also answered the question by typing.
We can't see that.
See that. No, I thought
summarise.
Either, but I did put stuff in. We didn't have a lot. We did have one or two parents with children with special education needs, and there were different effects. I mean, in some cases, actually medical staff and so on went out of their way to support them, but in other cases it was very difficult. And there was one particular case with a child who needed special shoes and had grown out of them, and it was completely impossible for her to get the proper fitting, and that was a problem. We know from other work, somebody asked about children and online GP services and phone GP services. And we know from other work that for some children, particularly children with severe autism, actually it's easier if you don't have to go to the doctors. Because if you've got, you know, something on your skin, for example, your parent can just take a photograph of it, go to the doctor, and you don't have to go anywhere near that doctor who you might find a bit frightening. So actually, for some children, not being able to go to the surgery is better, but there's no systematic research on that. And it'd be a really interesting thing to do.
Yeah, thank you. Donna, you know, I'm sitting here imagining being somebody who is working so hard in this arena out there. You know, you think about what health visitors and people, professionals have done, be above and beyond what they would normally do. Absolute atlases holding up the world here, and the stuff that we're talking about here is changing and flexing and doing stuff differently. I mean, what would you say to somebody who's saying, oh, I'm working my socks off right now, I have now to think about reshaping, rethinking? What would your response be to them?
Yeah, it's really challenging when you're in that type of situation, although I must say we've tended to we've heard that, but before that comes that I know everyone's really busy, and so there's that real feel of everybody acknowledges that the impact has been individual to each person. I think what I would say to them is thank you for all you're doing within your role and how you're supporting families, and then move on to that point around what is it that we can do to support, how can we work with you, are there pinch points? Because I think there's always that situation when you're on a treadmill, if you don't have that minute to stop, reflect, you don't always know how somebody can help you. So sometimes it might be the permission to do that and acknowledge that is also you doing your job. That's also you being valued, because you need to, you know, refresh yourself in to be able to support families and support others as well. And that's something that we've noticed across all of the workforces in terms of, yes, you've got a role to play here, but you are an individual, and COVID is affecting you, you know, as an individual as well, and being really sensitive to that.
Yes, yeah, brilliant. And finally, Tori, I noticed another question for you, which was, did you find yourself doing anything significantly different in this lockdown to the lockdown that you've experienced before?
The first lockdown, I think that I put a lot of pressure on myself to try and be that person that does everything. Like, you know, you don't want your kid to fail, so you go. We went fully into being a teacher, and I don't think that paid off for me. That didn't work. So this time around, it's been a lot more relaxed in what we do. We have a timetable from school, so I can always blame the teacher, which has been my go-to.
Very useful.
You know, yeah, the teacher said you have to do
Sorry,
this.
teachers.
Yeah, so every time he's had to do something, I said, well, it's what your teachers told me you've got to do, rather than it being mum's told you or dad's asked you. It's been the teacher said this needs to be done. So it's kind of made that bit work for us. And they've been more willing to kind of adapt. Even my youngest, who now is obviously at school, he's had to obviously do that as well. And the teacher said, so it's been my go-to for everything, even stuff it shouldn't be, but the teacher said so, it works.
Yeah, brilliant. Okay. So thank you very much, Donna. I'm sure we may get some stuff still coming in. I'm just going to invite everybody who's listening now we'd like to ask a couple of questions and for you to share your experience. So we've got a couple of questions for you. Firstly, as we heard from Carrie, the research report highlights the importance of developing parent peer support to combat isolation. And we'd really like to know, in your experience and with your knowledge, what's worked well for you that you know of in connecting families locally during lockdown? So that's the first question. And another recommendation looked at how to develop services delivered face-to-face and virtually to young children that include, that include the use of languages other than English. So again, that question, in your lockdown experience, what have been the best ways for services to connect with parents whose first language is not English? And please, again, post your comments in the comment box, and we're hoping to be able to pull out some key themes that we get from that for you afterwards. Donna, back to you, while people are posting their comments. You are, obviously SSBC is about systems change. So what do you think how do service providers need to flex and adapt learning what they've learned and what we're still learning from COVID? Do you have any thoughts about that while people get their comments in the
I
chat
think
bar?
it's been an interesting time around systems, because almost systems have been very difficult to shift and change. Yet what we saw happen in COVID, some phenomenal changes. You know, we would have never mobilised working from home in such a quick, effective way if it was something on an action plan or something that we were trying to achieve. So I think the impact of COVID-19 has shown us that we can, and quite often where there have been challenges, barriers in other organisations, we've seen that actually when we have that common shared goal, we can make some of those changes. And I think one of the other opportunities is around that collaborative commissioning, where we know from the ground this is what needs to happen, and rather than it going into a system that takes 2 years to come back, you know, to fruition, and then that issue or challenge might have changed, how can we commission in a slightly different way so that it's timely, effective, and importantly the right context for, you know, whatever service it is and wherever it's going to land within that. So, and I think it's important to sort of picked up on a point that Amy made earlier, and I've seen that Lynn McGuinness has made as well in the chat, around the picture was very different in different services during COVID-19, and we did see things like chat health come online that is a great opportunity for parents to ask questions and get a response back really quickly, and things like that all helped. As you know, Carrie said, we had some great feedback from different services and interactions with agencies, and I think the crucial bit is around making sure that that message is given consistently and by all partners, so that everybody knows about it.
Thank you, Donna. I'm just saying hello to our latest joinee. Hello. Amy, other thoughts, comments? I'm aware we're coming towards the end, but could you share some people's comments? I know they've been coming and it's really useful. And again, we're not going to lose those. You will get to see those afterwards. So, Amy.
It was just a comment really about the impact of COVID and sort of moving forward really with a backdrop of sort of funding cuts.
Yeah, and the challenges of that.
Absolutely.
Carrie, Donna, any response to that?
So I think that is all around us, making sure that we use learning, such as we've had from this report and other reports, to make sure that the finite resources we've got are used in the best way. And I think you get that when you linked closely with your communities, and that parent voice and it's co-produced, and also that you've got your key partners and stakeholders having that equal conversation with that common goal. Don't know if you wanted to add anything, Carrie.
I think we have to put children first, and we have to think of children first always. And one of the things that I felt coming out of the research was that policymakers tended to think, well, children are at home, and you know, small children are at home anyway, so nothing's changed for them. But actually, their lives were completely transformed and completely turned upside down, and we have to remember that. And I think one of the strongest things that comes away from it for me is outdoor activities and outdoor play throughout the year, because that way that will always be there.
Yeah, thank you. And just finally then, Jane from the Aspley Family Mentor Service has been talking about how they developed their virtual groups over the last few months with the support of interpreters, and they've still been people who have languages other than English as their first language have still been able to access the SSAH service and our infant massage group, which is really good. We've come to the end of our session. There's still lots to discuss, and thank you very much to everybody. Thank you in particular to Tara and Carrie and Donna and Amy, and to Beacon House in the background there for enabling this to happen. And a big thank you to everybody who's been listening and your comments. Let's keep the conversation going. Thank you.
Bye.
Bye.